Hi, I'm Neil Vaughan from Bournemouth University, and my project is looking at epidural needle insertion, which is a very common procedure in the UK. There are over 1,000 every day given in UK hospitals, and currently around 3% of patients get injured from epidural, and this can include paralysis or nerve damage. So we're developing a virtual reality simulator software that allows doctors to practice the procedure and improve their skills to reduce the NHS costs of compensation claims and also the patient injuries. And the system comprises of virtual reality software with a model of the human spine and soft tissues, and in combination with a haptic device which gives force feedback, so you can feel all the different tissue layers when you insert the needle on the simulator. And the main key point about this is it's a patient-specific simulator, so we can practice needle insertion on all different sizes of patient and different body shapes, including very obese patients, because recently the obesity epidemic is really increasing obese patients. And so we've also got a haptic devices been programmed with data from a clinical trial that collected data from inserting on real patients. So the haptic force feedback is very accurate feedback compared to other simulators, because this is all modelled from actual patient data. And using this wireless device, we recently conducted a clinical trial on real patients to measure the data from needle insertions, and that is all incorporated into the simulator software. And also this patient-specific software allows, we can modify the BMI and body mass of the patient to different sizes, so we can practice needle insertion on a whole range of different patients. And we've been working with some medical model making companies who are very interested in commercialising this, and there's a very big market within the NHS. There are over 168 NHS trusts, each with up to 10 hospitals, and so if we sold one to every hospital, this could generate around £4.2 million of revenue. And also several other opportunities within private hospitals, within around 400 within the UK, and also university hospitals. And then secondly, we could go to US markets, would be a very big opportunity as well. Some of the consultant epiduralists from local hospitals have been coming up with a lot of problems of injuries occurring, especially in obese patients, and they were requesting if we could design a simulator to assist with training, because the novice anaesthetists currently, when they come out of training in college, they go directly onto injecting on a real patient without any kind of practice. So this allows a kind of safe training environment where before a real patient they can practice in a virtual environment, and this will help to improve their confidence and get less patient injuries.